Hi, this is Dr. Jackie Gardner-Nix. This is session 6 of our series on migraines from both sides. I'm here with Christie Tate, nurse practitioner, and we're going to chat today about the influence of menstrual cycles on migraines, and also, if we can get to it, the time around menopause as well. Obviously, this is going to be for the women who have had issues around the hormonal changes and how they trigger migraine headaches. Um, in my case, I probably stopped treating women with menstrual migraines about 10 years ago. So I'm anxious to turn to Christie, who's currently treating, to find out if anything's changed since my day, because it wasn't that straightforward in my day. Women would come to me at the pain clinic after they'd had hormonal manipulation by their gynecologists or endocrinologists. And I was seen as the person of last resort, where I might choose to treat with an opioid. And that sounds pretty huge, but some women were severely affected and did need to go to the very strong medications. So, Christy, what's changed? What's new?
I think what hasn't changed is that women continue to be significantly impacted by menstrual migraine. It's a feature that goes along with migraine, and sometimes actually I think people don't always recognize it as migraine. They'll just kind of tie it in with a symptom of their period. So, we talked earlier about how around adolescence, this is where women tend to be more disproportionately affected by migraine, so 3 times more than men. We know that there's a kind of a hormonal component to things. So the menstrual related migraine can be very kind of disabling and impactful. They can go on for a lot of days. They can be really impairing to function. We do have medications like triptans, and we've used things like anti-inflammatories for a long time. And sometimes a combination of those two things can be used over those days of the menstrual period and help kind of calm things down. For women who are having a higher frequency of migraine attacks, where they have those ones around their period, but also maybe at other points, it's really important to capture the total number of headache days because they might need a preventative medication. Sometimes people shy away a little bit from that, but if you're having a high frequency of migraine attacks, even between the menstrual cycles, then prevention is going to be the only thing that brings that number of headaches down. We were talking a little bit before about, our hormonal treatments and birth control and these kinds of things used. And sadly, there's not a lot of data to clearly guide us. As clinicians, we always like when there's a big study and lots of numbers and we know that this has a good chance of working. But if you see your primary care provider sometimes discussing things like potentially birth control and whatnot, it works for some people, but then other people, it can also worsen headaches. We talked a little bit as well about, what can, women do if this is something they're experiencing. And tracking your headaches is always really, really valuable. It will give the individual migraine sufferer information, but it also tells us as clinicians a lot about patterns when it's happening. And if you can tie that into when you have your menstrual cycles, and if they are regular, then sometimes we can sort of preemptively treat by starting that acute treatment, which is your as needed treatment, even before or just before that migraine attack happens, because it can be a much more effective then. Do you find that's even different? I feel like that may have been something that we've been doing for a long time, Jackie. Is that very different than your practice over the years?
No, I think that was always the case. When you talk about preventatives, what you mean by that is that something taken every single day, which both you and I came to at certain points in our lives. And for some women who are really profoundly influenced by having migraines around their menstrual cycles, what you meant was they might continue to take every single day, right, throughout the entire period. But I mean, beyond that as well, right through the period cycle, right through the menstrual cycle, they would take something every single day. And as you say, people do shy away from the idea of that. If it is possible to be predictable because they're taking notes, they're writing in a diary, and they know when that migraine is going to come on, then to be episodic, in other words, to start taking something the night before, like the anti inflammatory, or like a triptan, and just take it until the danger, as it were, is over. And for some of the women I treated, that might be in the middle of the period, and some it would be beyond the period. So they might be taking it for a third of the time of the entire monthly cycle. Um, but I certainly was treating people with stronger doses of opioids if it was way beyond preventatives or beyond hormonal manipulation. Um, and they would start just before they knew the onset was occurring. It's difficult with irregular periods, but people do tend to know. There's a premonition that something's coming on, so they could start at that point as well. The other thing is that if we take anti-inflammatories or triptans too much, we can cause rebound headaches, rebound migraines. And so there is always that concern that during that period of taking them regularly for maybe even 10 days, it might induce the fact that you'll get that rebound migraine going into the rest of the month. So we need to actually do a session, Christie, on the phenomenon of rebound migraines.
Yeah, medication overuse. That's a very important point. So, acute medication, as needed medication, does have its limits. And if you're exceeding, usually kind of the amount that I use is 10 days a month. You want to keep it to less than 10 days out of the month to avoid that. So yeah, that's a great topic. So should we leave it there for our menstrual migraine
Well,
chat?
I think we might just mention that menarche, sorry, not menarche, menopause is often what women look forward to, knowing that it's going to get better after menopause. And again, it's very individual because mine didn't. Mine became more frequent and more complex. But for the majority of women, migraines do tend to soften, reduce in frequency and severity after menopause.
Yeah, it's very hard to kind of capture that data. And so one thing that I have heard sometimes from patients is they're sort of told, just wait till menopause and everything will get better. And it's kind of an unfair thing to just wait around for, because some women get much worse, some get better, and some just don't change in their migraine pattern. So I think it's always important to sort of address where you are right now in terms of the functional impact of the migraine, instead of, just waiting around for something to happen in another 10 years or so. So that's, I think, a really, really good point.
Okay. All right. Thank you for joining us, and we'll go on to the next session and hope that you join us for the future ones.
Take care, everyone.